ankle stiffness or hip pain holding you back? These simple mobility exercises can make a huge difference. In this video, I will answer why ankle mobility matters for knee and back health, what my top 3 exercises to improve ankle mobility are, and what could be causing pain in the front of your hips. Make sure you watch to the end because there is more to pain in the front of your hips than you realize. And if you have ankle issues, hip issues are down the road if you do not do the treatment correctly and complete the right treatment. So let's begin. Why does ankle mobility matter to knee and back health? Your ankles have to manage the structures above and then relay the information to the midfoot and forefoot for stability and balance. Here's the foot, midfoot, forefoot. Your back is so important and so related to this. Your lack of proper ankle mobility translates into basically looking at the knees or positioning the knee joint to basically try to stabilize the body and to minimize how much wobbliness happens at the structures above. And typically knee issues and ankle issues are directly related. Unless there is a direct insult to the knee joint, I look at knee issues as indications of dysfunctional movements in the joints above and below, meaning the hips and the ankle joints. Lack of hip mobility means the lower back now has to pick up what's not happening at the hip joint, which means your glutes and lower extremities no longer perform the glute and lower extremity jobs. So the next party in line to do the task becomes the lower back. We always talk about how everything's related, but there is the direct connection, connecting the dots is so important. And it basically, we want to see how exactly the lower back, ankles and knees impact each other in their performance or lack of. My top 3 exercises to improve ankle mobility are bear, I'm going to show you, and pumping bear. So what you want to do, you want to start in quadruped. So this point right here, go ahead and touch the corner, the pinky side corner of your hand. There is a bump there. That bone is called pisiform. You want to place your pisiforms on the ground. If you have wrist issues, you place them in front of your shoulders. If you don't, you place them straight down from your shoulder joints. Your knees are right under the hips and you're gliding your neck up. You're keeping your spine neutral so you're not arching it one way or another, and you're breathing biologically. Keeping the position intact, now you go to your toes and you're pressing down on your toes as if you're going down into the ground and you're about to kick back. Only you can't kick back because you're pushing inward. So now, pay attention to how I'm getting myself up. I'm not getting up, arching my back. My back is straight, like it's a piece of plywood that I don't have an option to bend. And I'm pushing and digging in, and I'm lifting myself up into this position. As you go up and down, the neutrality of your spine does not change. Once I'm up here, which is called bear, you don't need to look up. Your neck is gliding back. Now I can pump my legs. The pumping action actually works on the 2 muscles that come together to form your Achilles tendons, and that is so, as you know, important and plays a huge role with ankle mobility. So it's very important for you to practice pumping bear and bear because they just work. The next thing is ankle hinge against the wall. So what you want to do is you want to find a wall and you're going to stand 1 foot, your own foot, away from the wall, and then stand with your feet as wide apart as your pelvis. You want to stand plumb. That means the ear hole, middle of your shoulder, the ball of your hip joint, and the bump on the outside of your ankles, they all line up. You're 1 foot away from the wall. You're keeping yourself nice with the spine neutral. You're breathing biologically, pushing your sides out, and then not leading with your head, your chest, your pelvis. You bring yourself closer to the wall. So here we go. The goal is to get as close to the wall as possible without your heels lifting. You stop if your heels are lifting. You don't compromise the positioning of your neck or your pelvis or any other part of your body to move it out of that plumbed position. This will allow your body to practice working together as your ankle joint, everything hinges forward at the ankle joints, and then you're activating your posterior chain, all the muscles in the back portion of your body to work together, initiated with the leg to pull you back into a neutral position. Now let's talk about pain in the front of hips. Some of the common causes are too much internal rotation of the hips, forward tilt of the pelvis, labral tear, over laxity of the capsule of the joint, overloading the joint, and referred pain from the organs and muscles of the inside of your pelvis. Bottom line is that we need to find out why, for instance, there is too much internal hip rotation or why there is a tear in the capsule. Unless you find out the why behind the issue, you'll continue having the issue in different shapes and forms. Stretching and strengthening muscles is not the answer. Finding out why your muscles are tight or weak can get you to the root of the problem. I hope this makes sense. Thanks for watching. Make sure you subscribe to the channel, and until next time, take care.